Good day. I'm here with Dr. Husain, who is just a remarkable, remarkable individual, Vice Chair for Department of Psychiatry, the Program Director for the Geriatric Psychiatry Fellowship Program, and also the Director of Geriatric Behavioral Health here at Duke. Thank you, Dr. Husain.
Thank you very much for inviting me.
Thank you. So I wanted to talk with you today about the Geriatric Fellowship Program here at Duke. Can you give me a little historical background about the program?
So yes, interestingly, the Center of Aging and Behavioral Human Development was the first center of its kind in the United States. The Geriatric Psychiatry Fellowship Program was the first accredited geriatric psychiatry in this country. And since our inception, it has been that we had fellows who were trained in this field over many, many years, very successful geriatric psychiatrists, which are now doing their duties across the country.
That's phenomenal. Actually, as a resident working here, I get to work with geriatric fellows throughout the hospital, in addition to at the VA Medical Center and in ECT. For people who are coming here or interested to come here to train with Duke Psychiatry, what is the benefit of having a geriatric psychiatrist teach you about geriatric psychiatry as opposed to a general psychiatry?
So there are certain things that we need to realize. Number one, with the booming older population, the baby boomers, the cohort moving towards the right, getting older and older, you as a general psychiatrist will be seeing a lot more many geriatric patients. And you need to have some kind of specialized training. The three main Ds of geriatrics is dementia, depression, and delirium. And the way these present in the elderly population or the geriatric patient is somewhat different from what a DSM described for a general adult. And unless or until you are exposed to that, trained by a specialist in those three areas, you really don't get a full sense of how to manage them. And that's the kind of expertise that our group here at Duke, the Center of Aging, or for that matter, the Geriatric Division, brings for the training of the residents and the fellows.
You're beloved by the residents here as being a champion for our education and looking out for us professionally and personally. What is it about Duke Psychiatry that you find makes it such a great place to train?
That's a very kind of you for your compliments. You know, I was trained here at Duke 22 years ago. And once you're a Blue Devil, you're always a Blue Devil. It's in your blood. It never gets over. So I went after my training to Texas, and over a period of time became an endowed chair, professor, tenured. But as I said, it's something about Duke that brings you back. I consider myself blessed that I had an opportunity. Dr. Dan Blazer, who was the chief of geriatrics, invited me back. I just couldn't say no. And I'm back here. I'm very happy. I'm very proud. There is something in the air, you might say, not only just part of the training, the people, and the intellectual aspiration that Duke, the Department of Psychiatry and Behavioral Sciences, brings to you that make it so exciting to work with young people like you, medical students, undergrads, and all of them together make it a very happy medium to work.
Wow, we've just heard from 4 of our champions of the Duke Psychiatry program. Ultimately, I wanted to let you know that we're family, we work together, and you learn a heck of a lot while you're here. But in the end, it's most important that you go to a residency program that fits with your needs, that gives what you need to become the best psychiatrist you can be and the best person you can be. Ultimately, I hope you do end up coming here and want to join our program. If you have any questions, always feel free to ask.